You know, most people over the age of 60 have been told to watch their blood pressure, their cholesterol, their sugar levels, and their weight. And that's good advice, because those things matter a lot when it comes to your heart. But what almost no one ever tells you is that the tiny little daily things you do with your mouth, the way you brush, the way you floss, the foods you eat, and the way you care for your teeth can quietly be damaging your heart more than almost anything else. That's right, your smile, your gums, even the way you treat your dentures, all of it can be sending signals to your body that increase inflammation, raise your risk of clogged arteries, and quietly make your heart weaker and more vulnerable. And here's the real shocker: by the time you notice a toothache or bleeding gums, the silent damage to your heart may have already been going on for years. So if you're over 60 and you want to protect your heart, your independence, and your peace of mind, you need to hear this all the way through. Because I'm going to share with you 7 very common dental habits that most seniors don't even realize are harming them. And I'll also share how you can fix each one, starting today with simple, practical steps that don't require expensive treatments or complicated routines. Now let me ask you something. Have you ever skipped brushing your teeth at night because you were tired? Have you ever thought flossing was just optional? Have you ever ignored a bit of bleeding when you spit after brushing, assuming it's no big deal? If you've done any of those things, and almost everyone has, you need to know that those little habits can be just as dangerous to your heart as eating fast food or skipping exercise. Because science has shown time and time again that your mouth is the gateway to your body, and once bacteria sneak past your gums into your bloodstream, they don't just stay in your mouth, they travel. They find weak spots in your arteries. They increase inflammation. They trigger your immune system in ways that make your blood stickier, thicker, and more likely to form clots. And clots, as you know, are the #1 cause of heart attacks and strokes in seniors. But here's the good news. The very same habits that can damage your heart can also protect it, if you change them. And it doesn't take expensive dental work. It doesn't take hours of your day. In fact, just a few minutes of awareness and some simple daily choices can dramatically cut your risk of heart disease, while also giving you fresher breath, stronger teeth, and more confidence every time you smile. Imagine being able to go to your next doctor's appointment and hearing your doctor say your heart sounds strong, your blood pressure is down, and your arteries are healthier than before, all because you paid attention to your dental habits. That's the power you have in your hands right now, and I don't want you to miss it. So let's talk about these 7 habits one by one. The first one is skipping nighttime brushing. You may think, well, I brushed in the morning, isn't that enough? But when you go to bed without brushing, you're giving bacteria an all-night buffet. They feed on the food particles stuck between your teeth, and as they multiply, they release acids and toxins that irritate your gums. By morning, you might wake up with a bad taste in your mouth or sticky plaque on your teeth. But what you don't see is the inflammation spreading through your gums into your bloodstream. That inflammation is like a silent fire, and your body responds by sending immune cells to fight it. Those immune cells release chemicals that raise your risk of heart disease. In fact, researchers have found that people who skip nighttime brushing are much more likely to develop clogged arteries later in life. The fix? Make brushing before bed a sacred habit, like locking your front door. No matter how tired you are, no matter how late it is, give your teeth those 2 minutes. Think of it as brushing not just for your smile, but for your heart. The second habit is brushing too aggressively. Many people think the harder they scrub, the cleaner their teeth will be. But scrubbing hard with a stiff brush actually wears down your enamel and irritates your gums. When gums get irritated, they pull back slightly, creating tiny pockets where bacteria hide. Those bacteria can then travel into your bloodstream. Over time, aggressive brushing doesn't protect your heart, it damages it by fueling gum disease. Instead, use a soft, bristled brush, angle it gently toward the gum line, and let the bristles do the work. Think of brushing not like scrubbing a dirty dish, but like massaging a newborn baby's scalp. Gentle, consistent, and loving. Your gums will stay healthier and your heart will thank you. The third dangerous habit is ignoring bleeding gums. Too many seniors think bleeding gums are just a normal part of aging, or maybe the result of brushing too hard. But bleeding gums are actually one of the earliest signs of gum disease. and gum disease is directly linked to heart problems. The bacteria that cause your gums to bleed are the same bacteria scientists have found inside the arteries of people who suffered heart attacks. Let that sink in. If your gums bleed when you brush or floss, it's like a warning signal from your body, telling you that bacteria are already sneaking into your bloodstream. The fix? Don't ignore it. Talk to your dentist. Start flossing daily, even if it makes your gums bleed more at first, because with time, the bleeding will stop as your gums heal. And by stopping that bleeding, you're closing the door on bacteria that would otherwise march straight to your heart. The fourth habit is skipping flossing altogether. Flossing feels like a chore, and a lot of people, even those who brush faithfully, skip it. But brushing only cleans about 60% of your tooth surface. The other 40% is between your teeth, where your brush can't reach. That's where bacteria love to hide. And when you don't floss, you're leaving those bacteria undisturbed, free to grow, free to inflame your gums, and free to enter your bloodstream. Studies have shown that daily flossers not only have healthier mouths, but also lower risks of heart disease. So if you've been skipping flossing, today is the day to start. Don't overthink it. Just pick up the floss, work it gently between each tooth, and think of it as cleaning the hidden hallways where bacteria would otherwise plot against your heart. The fifth habit is relying too much on sugary mints and cough drops. A lot of seniors worry about bad breath, dry mouth, or little coughs, so they keep a pocket full of mints or lozenges. But most of those are loaded with sugar. Sugar feeds the very bacteria that cause gum disease. Worse, dry mouth from medications makes it even easier for sugar to stick around and cause damage. That sugar turns into acid, eats away at your enamel, irritates your gums, and once again fuels inflammation that travels to your heart. The fix? Switch to sugar-free mints or sea-little-based options, or better yet, sip water throughout the day. Hydration keeps your mouth clean, keeps bacteria at bay, and supports your heart at the same time. The sixth habit is ignoring dry mouth. Dry mouth might not sound serious, but saliva is your mouth's natural defense system. It washes away food, neutralizes acids, and even contains antibacterial properties. Without enough saliva, bacteria thrive. Many medications seniors take for blood pressure, cholesterol, or sleep can cause dry mouth, and that makes gum disease and heart damage much more likely. If you often feel like your mouth is sticky, or you wake up thirsty at night, you may already have dry mouth. The fix? Talk to your doctor about adjusting medications, use saliva substitutes, chew sugar-free gum, and drink water regularly. Keeping your mouth moist is not just about comfort, it's about protecting your heart from bacterial invasion. And finally, the seventh habit is skipping dental visits. After 60, a lot of people think, I've had my teeth for this long, I'll just deal with whatever comes. Or maybe you don't like dentists. Maybe you think checkups are too expensive or too much of a hassle. But here's the truth. Your dentist is often the first one to spot early signs of gum disease, oral cancer, or infections that can spread to your heart. Even if you feel fine, problems can be brewing beneath the surface. A simple cleaning and exam twice a year could literally save your life. Your dentist isn't just protecting your teeth, they're protecting your heart health too. So make that appointment, keep it, and think of it as a part of your heart care routine. Now let me pull all this together for you. Skipping nighttime brushing, brushing too hard, ignoring bleeding gums, skipping floss, relying on sugary mints, ignoring dry mouth, and skipping dental visits. Those are the 7 habits that may seem small, but they can secretly damage your heart if you're over 60. But you have the power to change every single one of them. And when you do, you're not only protecting your smile, you're strengthening your heart, improving your energy, and giving yourself the gift of more healthy, independent years with your loved ones. So tonight, when you pick up your toothbrush, I want you to remember this isn't just about clean teeth. It's about giving your heart the love it deserves, because every small step you take in your dental routine is also a step toward a stronger, longer, and healthier life. And if you found this message eye-opening, don't stop here. There are so many hidden connections between everyday habits and senior health that almost nobody talks about. That's why I make these videos, to give you the tools, the knowledge, and the inspiration to live your best life after 60. So make sure you come back to this channel, explore more of the videos we've prepared for you, and stay with us on this journey of staying strong, staying healthy, and staying independent. because your best years can still be ahead of you, and together we'll make sure they are